Good afternoon. My name is Brittany Malika, and today I will be presenting a strategic analysis of CVS Health. The company was founded in 1963. It started as a chain selling health and beauty products. It merged with a pharmacy benefit manager, Caremark RX, in 2007 and was renamed CVS Caremark. They rebranded to CVS Health in 2014, reflecting their broader commitment to healthcare. The company also acquired Aetna in 2018, which was the mark of transforming the consumer health experience. The external environment. So the United States healthcare industry is extremely complex and evolving constantly. The U.S. has one of the most complex healthcare systems in the world. It's highly regulated by many different federal and state agencies, as well as there are high costs. The U.S. has the greatest healthcare spending, sitting at $10,224 per capita. There are over 784,000 companies in the U.S. healthcare sector, and the driving forces of change are dissatisfied customers, increased cost sharing, skyrocketing prescription drug costs, as well as just the complexity of the overall healthcare system, and then also consumers wanting better access and convenience, and the overall digital transformation of the industry. So there are 5 forces: the threat of new entrants, bargaining power of buyers, threat of substitutions or other products, and then the bargaining power of suppliers. So I would say that the bargaining power of both buyers and suppliers is moderate. Healthcare is dependent on suppliers and also on buyers. So they do have some power in the industry. However, with the way that things are changing with technology and innovation, the bargaining power of suppliers is, I would say, decreasing because companies are able to reach buyers more directly. And then the bargaining power of buyers is actually increasing because they have new access and more transparency into the industry. And then the threat of substitute products or services is, traditionally this was not really a concern. However, with the way that the industry is changing with new technology and innovation and the insurtech movement, there are new products and offerings that are being designed. And so this threat could increase from low to moderate in the future. And then the threat of new entrants. There are several barriers to entry for this industry, such as production costs, capital costs, economy of scale is difficult to achieve. And all of these things are entry barriers. However, again, with the way that the industry is changing with new technology and innovation, it's really opening up the door for new entrants. And the insurtech movement, again, is on the verge of entering. And there are big tech companies that are also a threat and entering this market. So I would say that the threat of new entrants, despite all of the barriers, is actually very high right now. There are many factors that impact the healthcare industry: political, economic, social, technological, ecological, and legal. Big ones for this industry, especially political and legal. There are, again, they're regulated by state and federal agencies. There are many different acts and regulations and laws that are in place that regulate this entire industry. Economic factors definitely impact this industry in terms of inflation, unemployment, interest rates, which all impact consumer spending and therefore impact this industry, as well as policy changes and pricing adjustments. And then social factors play a role as well. Understanding the demographics of communities and the public definitely impacts the way that providers provide care and market to these individuals. And then the technological factors are definitely a big one with the digital transformation, technologies that are providing more convenience, more access, more innovative products and services. So this one is a really big factor for the industry right now. Key competitors for CVS Health in the industry. So Cigna's a global healthcare company. They also have a pharmacy benefit manager, also known as PBM, Express Scripts. And Express Scripts is the second largest leading PBM. So CVS Caremark being the first. So this poses a significant risk to CVS Health. United Health Group also has a similar model with health insurance and a PBM. Their PBM is OptumRx. They are fairly similar in revenue to CVS. So catching up in terms of revenue, and they also have partnered with Walgreens in the past, which could be a threat to the company. And then that leads me to the next one, which is Walgreens. And Walgreens is the second largest pharmacy retail chain behind CVS Retail in the United States. So this poses, again, a significant risk. They do have more stores in the United States and a global presence. However, CVS fills more prescriptions. And they also entered a partnership with Microsoft in 2019 to really digitalize their storefronts, which again is a huge risk to CVS Health. CVS Health's internal environment. So CVS, their mission is helping people on their path to better health. And when I looked at their mission and vision and core values compared to the other big competitors in the industry, they were very similar. But CVS Health, is committing to that purpose, and their strategy is creating unmatched human connections to transform the healthcare experience. They also rely heavily on their values. This is mentioned throughout their corporate social responsibility reports and in their ethics code of conduct. So innovation, collaboration, caring, integrity, and accountability are all extremely important to the company. Their corporate social responsibility message is grounded in innovation and working to solve the most complex public and healthcare challenges of our time. And they definitely live up to their corporate social responsibility in the different funding and initiatives that they have done over the year. They are really committed to doing what's right and helping the communities and society that they serve. A SWOT analysis of the company. So they have many strengths. Their brand, they have large penetration in the U.S. market, full suite of healthcare services and products, superior access, superior customer service, and extremely strong financial performance, revenues that have increased over the last 5 years, year over year. Their weakness is their business model can be imitated. Now, that's going, a little bit more to the healthcare pharmacy PBM business model. There really aren't any competitors in the industry that have a healthcare segment, PBM segment, and a retail segment. They do have dependence on the US retail market, and their opportunity is for e-commerce growth, digital transformation, international expansion, and as well as the aging population, and then different healthcare trends and crises. The threats are competition by big tech and insurtech. As I mentioned, this is, the threat of new entrants right now is extremely high because of the way that the healthcare industry is changing. Also, with that being said, this is also changing, consumers' behaviors are changing as well. And so this impacts their brick and mortar locations. Because if there's, this big movement to online and digital e-commerce, then that's going to significantly impact their retail locations. And then they also face regulatory pressures in the US, and this is really magnified by the fact that their market penetration is mostly in the US. So they are even more impacted by these regulatory pressures and do not have any other markets that they are highly competitive in. Their core competency, so they have integrated products and services across the entire spectrum of healthcare, and so this is really, it's a valuable resource because it minimizes costs, ensures profitability, and provides value in the form of affordability and convenience for customers as well as the company. And then this is rare because there are no other competitors out there that have this same exact model with the healthcare, PBM, and retail. And then it would be costly to imitate because one of these companies would have to acquire a retail pharmacy chain and integrate them into their business. And they are organized, they have optimal operational effectiveness, and a very effective value chain. Their generic competitive strategy is cost leadership. So minimize costs for retail pharmacies, formulary management, and healthcare services by sharing the resources and capabilities across the entire organization and value chain, which leads to increased efficiency and lower cost, as well as a competitive advantage. And then their corporate strategy for growth is horizontal integration through mergers and acquisitions. They have merged and acquired many companies really since the inception. And these mergers and acquisitions have led to a decrease in competition, increased opportunity for the company, as well as improved efficiency and enhanced solutions and innovative products that lower costs and differentiate the company's services and products because they have the whole healthcare spectrum under one company. So the strategic issue that I have identified for CVS Health is really the threat of digital transformation in the healthcare industry, and then the potential to disrupt the industry, especially new entrants such as big techs or the insurtech movement. Also, with Walgreens partnering with Microsoft and sort of leading this transformation is extremely concerning, and CVS needs to try to get ahead of this before this movement and transformation totally disrupts the industry. And CVS Health has limited capabilities when competing with some of these tech savvy companies. So, my recommendation for them to better position themselves and sustain a competitive advantage is to form an alliance with a tech company, much like Walgreens did with Microsoft. And this will allow them to get ahead of potential industry disruption, and it will allow them to further diversify and expand their company. Thank you.